My name is Jessica. I'm a Solutions Manager for Managed Outsource Solutions, and I'm here to talk to you about what is a talcum powder lawsuit and how are medical record services important in such cases. Talcum powder, a beauty product commonly used by adults as well as babies, could cause serious harm and injury to others. This may lead to talcum powder lawsuits and the need for comprehensive medical record services. Studies have shown that talcum powder could have a link to breathing difficulties and ovarian cancer. So what exactly is a talcum powder lawsuit? These are claims that the talcum powder manufacturers knew their product contained harmful ingredients such as talc and asbestos that could cause harm to users, but did not do anything to warn the consumers regarding such risks. How is talcum powder harmful to users? Talcum powder is made from a mineral called talc, and if someone breathes in or swallows talcum powder, it may cause talcum powder poisoning. Babies and children who happen to breathe in small dust-like particles could develop breathing problems. Apart from this, a number of consumers have filed claims for talcum powder lawsuits after diagnosed with ovarian cancer that is said to be caused by talcum powder. Talcum powder lawsuits for ovarian cancer are typically focused on women who use this powder for prenatal dusting. When used thus, the talcum powder particles could enter the body where it may cause inflammation and potentially lead to cancer. Also, birth control products such as diaphragms and condoms have been coated with the talcum-based powders, so individual cases may also depend on the way in which the consumer used talcum powder. It is important for consumers to understand that not all forms of ovarian cancer stems from the use of talcum powder. Why medical record analysis is key. For a valid claim, a review of the plaintiff's medical records is very important. Such a review would identify a cancer diagnosis or a diagnosis of respiratory problems. The medical chart provides sufficient evidence of the following diagnosis. One can file a lawsuit: ovarian cancer, fallopian tube cancer, borderline serous tumors, borderline mucinous tumors, mesothelioma. The medical record review team would be looking for and highlighting symptoms such as the following in their medical review report: breathing problems, would be reduced urine output or no urine output, eye irritation, throat irritation and cough, low blood pressure, chest pain, wheezing, convulsions and seizures, lack of responsiveness, drowsiness, lethargy, twitching of the facial muscles, arms, hands, legs, or feet, loose skin, lips and fingernails, blisters, vomiting, diarrhea. Medical records may include the following: blood and urine tests, chest x-ray, breathing support, ECG, medicines to treat symptoms, fluids through a vein, or IV. Medical record services. The medical record service teams will work with attorneys to support the talcum powder related claim with adequate evidence showing the link between the patient's diagnosis and his or her use of the talcum-based product. This evidence is obtained via relevant medical records of the plaintiff, including pathology reports and other medical evidence, expert medical testimony, witness testimony, documentation of the plaintiff's injury, medical care, losses, and associated expenses, the plaintiff's testimony, and other available documentation of talcum powder use. Criteria to file a talcum powder lawsuit. A medical diagnosis of a cancer that is linked to talcum powder products or asbestos. This is mainly applicable to ovarian cancer and mesothelioma. However, the plaintiff can qualify based on a lung cancer or cervical cancer diagnosis. A personal history of using talcum powder for personal feminine hygiene or cosmetic uses. Positive biopsy showing evidence of talcum powder must be present. A negative BRCA test. Women should not have the BRCA1 or BRCA2 gene that could predispose them to ovarian cancer. Time remaining before the statute of limitation expires in the plaintiff's case. The plaintiff could also keep the bills and records of expenses she had made since developing ovarian cancer. This will help the attorney determine the value of the claim. Compensation that may be available. Plaintiffs filing talcum powder lawsuits could receive compensation for physical pain and suffering, decreased life expectancy, mental anguish, loss of enjoyment of life, lost income and wages, loss of constrium. Medical record review for attorneys can help build the case. Medical records are very important for attorneys and understand the case thoroughly, strategize accordingly, and proceed with lawsuit. Attorneys can benefit from the support of a professional medical review company that will help organize and review the voluminous, difficult to interpret medical records that may be scattered across various healthcare systems. This will provide attorneys with adequate data to handle their cases. The hyperlinked medical record summaries and chronologies are very helpful to have a clear view of the case and the patient's treatment details. Medical record review support services are thus a partial option for busy attorneys handling case action lawsuits. Disclaimer: this blog is intended for general information purposes only and is not a substitute for professional legal advice. Please consult a lawyer for a professional opinion in this regard. Thank you for listening, and we hope you have a wonderful day.